Coccidioidomycosis is an infection that's caused by a fungus called Coccidioides. About 40% of people who are infected with it develop symptoms. Most commonly, they're flu-like symptoms like fever, cough, body aches, and fatigue. Some people can feel sick for weeks to months. And a smaller proportion of people can get very serious disease or even die if the fungus spreads from their lungs to other parts of the body, especially the lining of the brain, causing meningitis. Some of these people can be affected for years, even for life. It's also called valley fever because many of the first cases discovered in the U.S. were in people who lived in California's San Joaquin Valley, which is still one of the main areas that's affected by this disease. It's important to note that people get valley fever in many other places besides the San Joaquin Valley, especially southern Arizona cities like Phoenix and Tucson. The fungus Coccidioides lives in the environment, in soil and dust in certain places. In the United States, we know that these areas include Arizona, California, Nevada, New Mexico, Utah, Texas, and south central Washington state. But the fungus probably lives in other areas too. People become infected by breathing Coccidioides spores in the air. Symptoms from the infection usually begin 1 to 3 weeks later, and about 95% of people who get valley fever live in Arizona or California. The symptoms of valley fever can be the same as other conditions like bacterial pneumonia, so it can be difficult to diagnose sometimes. Lots of people get antibiotics for suspected bacterial infection before being diagnosed with valley fever. It's not possible to diagnose it based only on the symptoms. You need a lab test. Usually it's a blood test, but a doctor might take a sample of respiratory fluid or tissue for culture, depending on the part of the body that's affected. But cultures can take a long time to get a result, and even the blood test can take several days. Antibacterials won't make valley fever any better since it's caused by a fungus, not bacteria. And there can be side effects from taking antibacterials, things like rash, yeast infections, diarrhea, and severe allergic reactions. And of course, another concern for giving people unnecessary antibacterials is that it can promote resistance. For some people, the symptoms will go away on their own without treatment in a few weeks or months. It's not always clear if antifungal treatment makes symptoms better for the mild to moderate forms of coccidioidomycosis, but people who are at higher risk for developing the severe forms, like people with weakened immune systems, usually need prescription antifungal treatment. And people with severe infections always need antifungal treatment.